Your doctor runs your blood work every year: cholesterol, blood sugar, complete blood count. You get a call a few days later. Everything is normal. You feel relieved, but here is the problem: the standard blood panel your doctor orders was designed in the 1970s. It was not designed to catch the conditions killing most Americans today. It was designed to confirm you are not already in a crisis. There is a difference between not being in crisis and actually being healthy, and that gap between the tests your doctor runs and the tests that would actually tell you what is happening inside your body is where most chronic disease lives, silent, undetected. For years that in the next 10 minutes I am going to show you the one blood test that your doctor almost never orders unless you specifically ask for it. The test that detects insulin resistance, fatty liver disease, and cardiovascular risk, all at once, years before any symptom appears. That I am also going to tell you exactly what to say to your doctor to get this test, because most of them will not offer it. And some will push back when you ask. Stay with me. This might be the most important medical information you have ever watched. Before we get into the test itself, you need to understand why standard blood work misses so much. The most commonly ordered test for metabolic health is the fasting glucose test. Your doctor takes blood after you have not eaten for 8 hours and measures how much glucose is in your bloodstream. If it is below 100 mg per deciliter, you are told you are normal. Here is what that test does not tell you. It does not tell you how hard your pancreas had to work to get your glucose to that normal level. It does not measure insulin at all. Think about it this way: imagine a factory with 2 workers. One worker is healthy and produces 10 units of output with minimal effort. The other worker is exhausted and has to work 5 times as hard to produce the same 10 units. From the outside, both factories look identical. Same output, same result, but one is heading toward collapse. This is exactly what happens with insulin resistance. Your glucose looks normal on the test, but your pancreas is working 5 times as hard to keep it there. And that information, the most important information, never gets measured. The test that measures it is called the fasting insulin test, and this is the one your doctor almost never orders. The fasting insulin test measures the actual amount of insulin circulating in your bloodstream after an overnight fast in a healthy metabolic state. Fasting insulin should be between 2 and 6 microunits per milliliter. Most functional medicine doctors consider anything above 10 to be a sign of significant insulin resistance, even if your glucose is perfectly normal. Here is the shocking part: the conventional medical reference range for fasting insulin goes up to 25 microunits per milliliter, meaning your doctor could look at a result of 24 and tell you it is normal. At 24, your pancreas is working approximately 4 times harder than it should be. You are deep into insulin resistance. And you are on a direct path toward type 2 diabetes, cardiovascular disease, and non-alcoholic fatty liver disease, the condition we covered in our first 3 videos. But on paper, you are normal. This is not a conspiracy. This is a problem with reference ranges that were set based on average population data, not optimal health data. The average American is metabolically unhealthy, so the average becomes the reference. And the reference gets called normal. Now, fasting insulin alone is powerful, but there is an even more comprehensive picture you can get by combining it with one additional number you already have from your standard blood work. It is called HOMA-IR, Homeostatic Model Assessment of Insulin Resistance. This is not a separate test. It is a calculation using 2 numbers you may already have: fasting insulin and fasting glucose. The formula: fasting insulin multiplied by fasting glucose, divided by 405. A result below 1.0 is optimal. Between 1.0 and 1.9 is early insulin resistance. Above 2.0 is significant insulin resistance. Above 2.9 is severe, and correlates strongly with fatty liver disease and prediabetes. You can calculate this yourself right now if you have your fasting glucose number from a recent blood test. The only missing piece is the fasting insulin, the test your doctor has not run yet. Did you know that over 80% of people watching this channel are not subscribed? This is video 5 in our series. Every video connects to the next. The next video covers what to actually do when you get your results back, including the specific numbers to look for and the protocol to reverse them. Hit subscribe right now. And the next video might be the one that changes everything for you. Now, beyond fasting insulin and HOMA-IR, there are 2 additional markers that together give you the most complete picture of metabolic health available through standard blood testing. Marker number 2. Triglycerides. Most people know triglycerides are measured in a standard lipid panel. But most people do not know what the number actually means or what level to target. your doctor tells you that under 150 mg per deciliter is normal. Functional medicine research suggests that under 100, and ideally under 80, is optimal for metabolic health. Here is why triglycerides matter so much. Elevated triglycerides are one of the most reliable early markers of insulin resistance, often appearing years before glucose levels change. When you consume excess carbohydrates and sugar, your liver converts them into triglycerides and releases them into the bloodstream. High triglycerides combined with high fasting insulin is one of the strongest predictors of fatty liver disease available without imaging. If your triglycerides are above 100, your liver is already under metabolic stress. Even if your doctor told you they are fine. Marker number 3. The triglyceride to HDL ratio. This is the most underused and most powerful metabolic marker in standard blood work, and almost no doctor ever mentions it to their patients. Take your triglyceride number divided by your HDL cholesterol number. A ratio below 2.0 is excellent. Between 2.0 and 3.0 is acceptable. Above 3.0 indicates significant insulin resistance and cardiovascular risk. Above 5.0 is a serious warning sign. Studies published in the Journal of the American College of Cardiology found that this ratio predicted cardiovascular events more accurately than LDL cholesterol, the number your doctor focuses on almost exclusively. This ratio is also one of the most sensitive markers for non-alcoholic fatty liver disease, the condition we covered in videos 1 through 3. The remarkable thing about this ratio, all the numbers you need are already in your standard blood. Your doctor has this information right now. They just never calculated it for you. Go to your last blood test results. Find your triglycerides. Find your HDL. Divide. Write that number down. Now let me bring all of this together into one practical framework, the complete metabolic picture. The 4 numbers that tell you what is really happening inside your body are these. Number 1, fasting insulin. Target under 6. Anything above 10 requires attention. Number 2, HOMA-IR. Calculate it yourself. Target under 1.0. Above 2.0 means your metabolic health needs intervention. Number 3, fasting triglycerides. Target under 100. Above 150 is a warning sign regardless of what your doctor says. Number 4, triglyceride to HDL ratio. Target under 2.0. Above 3.0 requires immediate lifestyle changes. 3 of these 4 numbers you may already have from your last standard blood test. The only one missing is fasting insulin, and here is exactly what to say to your doctor to get it. Walk in and say this: would like to add a fasting insulin test to my next blood panel. I have been reading about insulin resistance and I want to establish a baseline. I understand this is a simple blood test and I would like it added to my order. That is it. No argument, no confrontation. A simple direct request. If your doctor pushes back, and some will, you can add, I would also like my HOMA-IR calculated from the results. In most cases, a doctor who hears a patient use the term HOMA-IR will take the request seriously. If your doctor refuses entirely, you have 2 options. Order the test directly through a service like LabCorp or Quest Diagnostics without a doctor's order. In most US states this is legal and costs between $30 and $60. Or find a functional medicine physician who routinely orders this panel. Here is the most important thing I want you to take from this video: you are not at the mercy of the standard blood panel. You are not limited to the information your doctor chooses to give you. Your health is a system, and every number in that system tells a story. The question is whether anyone is reading all of them. Now you know which ones to ask for. In the next video, I am covering what to do when the numbers come back, the specific lifestyle protocol that brings fasting insulin from high to optimal, and what happens to your liver, your energy, and your body composition when it does. Comment below. Have you ever had your fasting insulin tested? Write yes or no. I want to know how many people watching this have never been given this basic piece of information, and if you know someone who has been told their blood work is normal but still feels wrong, send them this video. That number they have never tested might be the answer. This is general educational content only. Always consult your physician for personal medical advice. See you in the next one.